The National Health Insurance Bill is currently before the Portfolio Committee. This bill is the first step in government's plan for universal health coverage. The department says once that's achieved, all citizens will be protected from the financial impact of seeking health care by 2030. Opposition parties, however, expressed concern about the department not being able to get the basics of healthcare right.
My constituency office, just in Hopetown alone, this is apart from Britstown, that had its own issues where a patient died because there were no emergency services available. In Hopetown, there were 2 cases. One of a young man that was struggling and had an emergency, couldn't get to a hospital. Finally, they had to get somebody to get a tractor, to get a child to a point where a private vehicle could take the child to Kimberley Hospital. That child died.
The NHI debate has had widely opposing views since it was first introduced. The DA insists that currently everyone in South Africa has access to universal health coverage.
There is nobody in this country who does not have access or cannot go to a public health facility for care. Absolutely not. We all can. Whether you have money or not, everybody in this country has access to a public health facility. What they can't get is quality of health care. And that problem lies solely on the doorstep of this department.
ANC MP Sidumo Dlamini says NHI is critical in South Africa and has called on all involved in passing the bill and implementing the legislation to get their ducks in a row.
That if we combine the two wrongly, indeed we will contribute in delaying South Africa to realize NHI and the universal health suffrage. It is important that the proper balancing of these policy discussions is very, very important. We indeed have to pass the bill in Parliament.
The Health Department clarified that currently the concept of universal health coverage does not exist in South Africa.
If there's no facility, or you have to drive past 5 or 6 facilities that are excluding you because they are private facilities and you don't have a medical scheme, then you don't have access to those facilities and you don't have access to those specialists and services and so forth. And the big challenge we have is more than half of all the spending in healthcare at the moment in South Africa is spent on only those who have medical schemes. So if we doubled the public health budget, we would still not be able to get to half of the spending in the private sector per capita. And clearly the only way to do that would be to double the budget. So the solution is in the National Health Insurance Bill.
The NHI bill was first tabled in Parliament in 2019. 4 years down the line, committee chair Dr. Kenneth Jacobs said he was encouraged to see the department give a proposed implementation date. He said in terms of timelines, the committee has about 4 meetings left to discuss the bill. One of these meetings will deal with the legal opinion on the bill. Abra Barbia, SABC News, Parliament.